ellipse again. H-O-F. Cool. Sure. More. One. Sure.
Hi, Angelina. How are you doing today?
I'm alright. I could be better, but I've just been feeling some strange things, so I just wanted to get that checked out.
Okay. Let's go over some of the information that I have here. I want to make sure that the file is complete.
Okay.
Can you verify your date of birth?
July 21st, 2005.
Okay. And your last name?
My last name is Warner.
Okay. Do you have any allergies?
No allergies.
Are you taking any medications on a daily basis?
No, not that I can think of.
When was your last checkup?
About 2.5 months ago.
Okay. And are you experiencing any pain right now?
Not any pain right now, no.
What kind of issues would you like me to address?
So the past couple days I've been feeling like a weird tingling sensation going down my arms. And also I've noticed that my eyesight has been slightly blurry.
Okay, let's go over your vision. Do you wear contacts?
I do not.
And how long ago have you noticed this?
I'd say about 5 to 6 days ago.
And have you noticed that blurry vision in both eyes or just one?
It's mostly just my right eye.
Okay. And have you noticed any floaters or any colored things that float in your vision? So just blurry vision.
Yeah.
Okay. Okay, and for the sensation that you're having on your arms, is that on and off?
Yeah, it's pretty on and off. When it does happen, it lasts about 5 to 10 minutes and then it'll slowly go away.
And for how long has that been going on?
That's been going on for about a couple weeks now.
Okay, so we started with sensory problems on the arm. Any other loss of sensation anywhere on the body?
Not that I'm aware of, no.
Okay. Have you noticed that you're a little bit more clumsy or that you cannot hold a cup properly?
I've noticed that when I get up pretty fast, I tend to get a little lightheaded, but other than that, no.
Okay. How well do you sleep at night?
It's been pretty consistent, but I'm getting around 6 hours.
That's not a lot. I would say that women do need a little bit of extra sleep. So how do you feel in the morning?
In the mornings, I am usually pretty tired for about like the first hour and a half, and then that's usually when I start to get more energy.
Do you drink coffee?
Yeah, not every day though.
Okay. Any other stimulants that you're taking? Okay. So I'm going to ask you a few questions. I want to make sure that neurologically everything is okay. Can you please tell me today's date?
Today is October 9th.
Okay. And who is the current president?
It is Joe Biden.
Okay. What is 2 plus 3 plus 6?
11.
Okay. And can you count from 10 backwards every 2 digits?
10, 8, 6, 4, to 0.
Okay, perfect. And so everything looks good. Alert and oriented ×3. You know exactly where you are and the circumstances. I'm going to take your vital signs. Have you noticed any hearing problems, hearing changes? Okay. Any facial pain? When was the last time you had a drink?
This morning when I woke up.
Okay. So we're going to take your temperature. This will be sublingual. We're going to put it under the tongue. I'm going to have you hold this for me. Perfect. And then this is going to measure your oxygenation and your heart rate. Good. And we'll take your blood pressure. I'm going to put it on your right arm. Okay, I'm going to have you relax. Uncross your legs for me, please. Perfect. Oxygenation is 97% on room air. Heart rate is very slow and relaxed. So, heart rate is 63, oxygen 97 on room air. Respiratory rate also very normal, 12. Let's go ahead and check. 97.7 Fahrenheit. Okay. Right. This is gonna go right in between the crevice here. Okay, I'm gonna have you relax. Okay. Blood pressure is a little bit low. 98 over 60. That might be one of the reasons why you're feeling a little bit lightheaded. I'm going to listen to your heart and lungs. Okay, you can go ahead and breathe normal. I can hear only S1 and S2. No S3, no S4. Go ahead and take a deep breath in and hold it for 3 seconds. 1, 2, and 3. Breathe out. Good. No murmurs were heard. Go ahead and breathe in and fully exhale. And again, breathe in and fully exhale. I'm going to listen to the sides as well. This is going to allow me to explore a little bit better the lower parts. Breathe in and exhale. Breathe in and exhale. Okay. All right, I'm going to take a look at your hands and arms. So you can go ahead and relax this And first, capillary refill is within 2 seconds. I'm not noticing any splinter hemorrhage or yellowish discoloration. The nail beds look normal color. Sometimes we would see a lot of redness. There's no pitting edema. There's no signs of any liver problems. Okay, checking pulses. Just going to check and see if they synchronize. Good. And let's check this palm. I'm noticing a little bit of redness on the right side. Good capillary refill. Nail beds are normal, a little bit of white strings. That could be just from a little bit of trauma. Okay, I'm going to go ahead and slowly palpate the arm. I'm going to do a few tests once you lay down to check exactly the sensory problems that you're having. I'm going to check reflexes. Okay, that's good. Go ahead and relax your whole arm. Perfect. Good. Good. Okay, go ahead and relax. Good. Relax. Okay, perfect. There are a few things that I'm going to check first. Is your pupillary reaction to light, and then we're going to check for blurriness and peripheral vision loss. So go ahead and look right here straight at my nose. I'm going to flash a light in your eyes. Okay. I'm going to lower your eyelid. Okay. Now go ahead and follow the light with your eyes only. Don't move your head. Okay. Now go ahead and look right here for me. Not noticing any rapid eye moving. A little bit on the right side. That could just be a twitch. Go ahead and look right here. Okay, that was good. So I have here a few cards. Every card has a number or a shape on it. Go ahead and cover your right eye first. And can you tell me what number you see right here?
26.
Okay, now go ahead with your left index finger. Try to trace this S shape from one X to the other. Okay. What number do you see here?
98.
Okay, that's 96. Go ahead and do the same thing again. Okay. And what numbers do you see here?
42.
Okay. So let's go ahead and switch eyes. What number do you see here?
This one's a little blurry.
Okay. What about this one?
26.
Go ahead and trace this road for me. Okay, very good. That was good. And what number do you see here?
90. I can't really tell what the second number is.
Okay, that's okay. And lastly, can you trace this again? Okay, very good. Okay, go ahead and tell me what color you see here.
Orange. Yellow. Blue. Purple. Yellow. Pink. It's like a purple pink magenta.
Okay, now here I have a few pictures. I'm gonna have you just give your fast interpretation. You don't have to think too much, just whatever comes in your mind the first moment that you see the picture. That should be good.
An eye. A dinosaur.
Okay.
A leaf. A frog. A rainbow. Lips. A lips again.
Okay. So the interpretation was pretty good, I would say. So neurologically, there's nothing, that we should be continue focusing on. I'm going to check your optic nerve. Okay. Go ahead and look straight behind me at the wall. I'm gonna come very close to your eye and take a look inside. Looking at the retina, optic disc. See if there is any inflammation. And this eye looks good. Okay, keep looking behind me at the wall. A little bit of redness behind the optic nerve. That could be putting a little bit of pressure and causing some of that blurriness. Okay, so let's check your ocular reflex now. What this entails is touching you with a very soft surface on the white part of your eye. We're looking for a very rapid movement or any kind of blinking, so you're not going to feel usually anything. Go ahead and look straight. Good. Go ahead and look straight. Very good. Okay. Go ahead and cover your right eye for me. And with your left hand, go ahead and hold this. And extend your arm all the way. Perfect. Go ahead and try to read the last row, starting with the first letter to the left.
L, T, F, P, H.
Okay, what color do you see right here?
Red.
And here?
Green.
Okay, go ahead and read the second last row.
C, F, D, H, J.
Okay, let's go ahead and switch eyes. Okay, so we're going to do the same thing now. We're starting with the first letter towards your left.
L,
Right, I meant to say.
H, P, E, T, L.
Okay, and what about the second last row? Same thing, to start with the first letter towards the right.
J, H, O, F, O.
Okay, what color do you see here?
Red.
And here?
Green.
Okay, thank you very much. That looks good. Next thing that we're gonna do is to check your ears. And your hearing. Okay, go ahead and look that way for me. You're just gonna feel a little bit the tip of the otoscope inside. The tympanic membrane is pro-gray. I'm not seeing any cerebrospinal fluid, so that's good. We'll do the same thing on the other side. Let me know if you feel any kind of pain. This is very swollen here. Are you experiencing any pain on the right side?
No, it might be because I slept with earbuds in.
That definitely could cause this type of problems, but I'm gonna have you lay down, change into a gown, and we will examine your hearing in detail to make sure that your hearing is not obstructed by the swelling.
Okay.
And then maybe we'll start an antibiotic treatment.
Alright, sounds good.
I'm going to start by palpating your lymph nodes on both sides and checking submental lymph nodes for any inflammation. Postauricular lymph node on the right side is a little bit swollen. Just gonna move the gown a little bit to the side. Can you lift yourself a tiny bit? One more time on the right shoulder. Perfect. So just slowly palpating right above the clavicles. There's another set of lymphatic tissue that we just want to make sure it's not swollen. Okay. Perfect. Okay. Soft tissue is normal, not feeling any fluid. Okay, I'm going to palpate your sinuses. We're checking for sinus infection that could put pressure on the nerve complexes around the face. Sometimes this can cause blurry vision. Okay, and I'm gonna feel my fingers right under your eyes on each side of the nose. Also, we're palpating around the eyes to see if there's anything that's putting pressure. Okay. A little bit of swelling on the left side. Okay. Scrub your skin. Okay, this is gonna feel a little bit wet. Just wiping the main areas that we're going to test. Okay. Go ahead and tell me when you don't feel this vibration anymore.
No. No.
Okay. Go ahead and tell me which position here is louder. This is position 1 or 2. 1 or 2.
1.
Go ahead and tell me with which ear you hear this sound.
Right. Left. Both.
Okay. I'm going to put a few drops on your tongue. This is a piece of paper that has a very strong taste. Go ahead and tell me what that tastes like.
It tastes a little bitter.
Okay. Let's go ahead and try something else. And I'm going to put it on the other side of your tongue.
That one was sweeter.
Sweet. Okay. Go ahead and taste this one as well.
That one was really bitter.
Really bitter. Okay, so the taste is not obstructed. Now we're going to check your smell. Okay. Next, I'm going to check patency of your nares. Go ahead and breathe in, breathe out. Good. And again, breathe in, breathe out. Perfect. I have here a few scents. They are pretty strong, so if you have no obstruction and there's nothing going on at the nervous system, then you should have no problems in understanding the smell. Go ahead and keep your eyes closed and try to identify.
It's kind of vanilla.
Okay, so that one was vanilla. Let's try this one.
Kind of like a fruity smell. That one's mint.
Mint.
That one, I'm not sure, but it is pretty strong.
Okay, this one was garlic.
Oh, that one kind of smells like roses or some type of flower. I can't really smell that one. That one smells fresh. That smells like lilac. Cinnamon. I'm not sure.
Okay, I'm just gonna bring it a little bit closer.
It kind of smells like the juicy fruit gum. I'm not sure what that scent is though.
Okay. Okay, now that the solution dried up, I'm going to do a few sensory tests. We're gonna start with changes in temperature. I'm going to touch you with two textures. One is going to feel cold and the other one is going to be warm. Go ahead and tell me if you feel cold or warm.
Cold. warm, cold, cold, warm, cold, warm, cold, warm, 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 cold, cold, warm, warm, cold, cold, warm, warm.
Okay. Now I'm going to touch you with two textures. One is going to feel a little bit sharp, but don't worry, it's not going to penetrate the skin in any way. And then the other one is going to be dull. It's going to be kind of like a fluffy sensation. So go ahead and tell me if you feel this sharp or dull.
Sure. Dull.
Excellent. So go ahead and tell me if you feel this sharp or dull.
Sure.
And does this feel sharp all the way?
Yeah. Dull. 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 Sharp. Sharp. Sharp.
Okay, I'm going to move to the cheeks area.
Dull. Dull. Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. Sharp. Sharp.
Does this feel sharp all the way?
Yeah.
What about now?
Yeah.
Okay. Next, I'm going to touch you with two textures. One is going to feel dry, the other one is going to be wet. Okay, go ahead and tell me if you feel this wet or dry.
Dry. Dry. Wet. Wet. Dry. 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 Wet. Dry. Wet. Wet. Dry. Wet. Wet. Dry. Wet. Wet. Dry. Dry.
Okay, now what I'm gonna do is I'll mix all of these together. So we have about 6 sensations that we're going to check in the same time. We're gonna have warm, cold, sharp, dull, and wet and dry.
Dry. Wet. Sharp. Dry. Wet. Dull. Dry. Don't. What? Cold. Don't. Sharp. What? Don't. Dry. What? What? Dry. 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 What? Don't. Don't. Dry. Sharp. Sharp.
Now I'm going to focus on the hairline as well, and then we'll check the scalp. Go ahead and tell me if you feel this sharp or dull.
Don't. Sharp. Sharp. Don't. Don't. Sharp. Don't. Sharp. Sharp. Sharp.
Okay, a little bit of sensory problems there. So now I'm going to check your scalp. Okay, I'm noticing a lot of redness on the scalp area. So I'm guessing that this is where you keep your part, correct?
Yeah.
In the middle.
Yeah.
Looks like sun exposure. It's also a little bit dry and flaky. Okay, I'm gonna be very gentle on this part so that we do not infuriate the skin any further. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Don't. Wait, I'm so sorry. Are you still doing it?
No, that's okay. So yeah, there is a little bit of sensation loss on the sides. Did you feel that?
Not really.
What about now?
Yeah, I do feel that.
Okay, let's do that one more time. Did you feel that?
Yeah.
Was that sharp or dull?
Sharp.
Okay. Sharp or dull?
Sharp.
Okay. Go ahead and tell me if you feel this sharp all the way. Was there any part where it didn't feel sharp?
Toward the beginning.
Towards the beginning. Okay, go ahead and tell me if you feel this warm or cold.
More.
Warm. Good. And does this feel warm or cold?
More.
What about now?
Cool.
Warm or cold?
More.
Warm. And now?
More. Cold.
Okay. Go ahead and tell me if you feel this 1, 2, or 3 taps.
1, 2, 1, 3, 1, 2.
Okay, go ahead and tell me if you feel this 1 or 2 pressure points.
1. Yeah, I can feel that.
Do you feel that 1 or 2?
1. 1. 2. 2.
Okay, go ahead and turn your head towards your left. Perfect. Okay. There's some redness on the right side of the cranium as well. Go ahead and tell me if you feel this too. 1, 2, or 3 taps.
1, 2.
Okay.
1, 2, 2, 3.
And does this feel sharp or dull?
Sharp. 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 Cool. And sharp. Sharp. Sharp.
So both of them were sharp. Does this feel 2 or 1 pressure point?
1. 1. 1. 1. 1. 1. 1. 2. 1. 1.
Okay. I'm going to switch to the left side. Go on and turn your head whenever you're ready. Okay, go ahead and tell me if you feel this sharp or dull.
No. Sharp. 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 Dull. Sharp.
And does this feel sharp all the way? Does this feel cold or warm?
Cold. Cold. Cold.
Do you feel this 2 or 1?
1, 2, 1, 1, 2, 2.
Very good. Okay, I'm going to go ahead and check the sensation on your arms now. Alright, so the one on the right, kind of on this side, you showed me that you're having more tingling sensations.
Yeah.
Okay. Go ahead and have your eyes closed and tell me if you feel this on the left or right.
Right. Left. Right. 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 Left. 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 Right.
Okay, now go ahead and tell me if you feel this all the way down.
Yeah.
Okay, same thing on the other side.
When it gets to the crease of my elbow, I can't really feel.
Over here.
Yeah.
I'm going to touch you with 2 pressure points, but I need you to tell me if you feel 2 or 1, okay?
Okay. 1, 2, 1, 1, 1, 1, 1, 1, 1, 1, 2, 2, 2, 2, 2.
Okay.
1, 2, 1, 1, 2, 1, 1, 1, 1, 1, 1.
Go ahead and tell me if you feel this on the left or right.
Left. 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 Right. Right. Right.
Does this feel sharp or dull?
Sharp.
Okay. Go ahead and tell me if you feel this sharp all the way down.
Yeah.
And does this feel sharp or dull?
Sharp.
Go ahead and tell me if you feel this sharp all the way down.
It's the same spot that I couldn't feel it.
Okay. Now that you're laying down, I'm going to check your reflexes again. Good. Good. Squeeze your arm. Good. Okay. Go ahead and squeeze my fingers, please. Okay. And go ahead and try to catch my thumb. Okay, very good. Okay, perfect. Okay, you're gonna feel my hands just kind of wrapped around the tibia here. Just slowly palpating. We're looking for any edema. Gonna slide my fingers right under. Go ahead and relax. Okay. Okay. Going to check your Babinski reflex. So it's gonna feel a little bit sharp, okay? Good. Negative on the right side. And the left side as well. Let's go ahead and check pulses. Okay, penile pulses are 2+, strong and synchronized. Okay. Normal temperature. Capillary refill is within 2 seconds. So that's very good. Let's go ahead and do a sensory test. One is going to feel wet, the other one is going to be dry. Go ahead and tell me if you feel this wet or dry.
Wet. Dry. Wet. Dry. 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 Wet. Dry. Wet. 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 Dry. Dry. Wet. Wet. Wet.
Okay. Okay, go ahead and tell me if you feel this warm or cold.
Warm. Cold.
Okay.
Cold. Cold.
Okay. Does this feel warm all the way?
Yeah.
And what about now?
Yes.
Does this feel cold all the way?
No.
Where does it stop feeling cold?
Just about there.
Okay. And does this feel cold all the way?
Yeah.
Okay, so mainly on the left side. Go ahead and tell me in which direction your toe is moving, towards you or towards the wall in front of you.
Towards the wall. Me. Me. The wall. Me. The wall. The wall. Me. The wall. Me.
Go ahead and wiggle your left toes. Okay. Same thing on this side.
Me. The wall.
me, me, tua, 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 me, tua. Okay. Wiggle your right toes. Okay. Go ahead and push with the pads towards me. Okay, I'm gonna slide my hands under your heels. Go ahead and push down. Okay. I'm gonna try to open the legs. Don't let me do that. Good. And I'm gonna slide my hand under your leg. Go ahead and push down. Good. Same thing, push down. Good. 1 second. Let's do both at the same time. Push down. Got a little bit of weakness on the left side. Okay, so let's go ahead and check your back and see if there's any spinal cord issues. I'm going to start by palpating your cervical spine. Just going to go ahead and feel for any popping sensations. I'm going to start by palpating your cervical spine. We're looking for any crepitus, any ganglions that might be swollen. Let me know if you feel any kind of pain. I'm noticing there's a little bit of decreased movement towards the end of the thoracic spine. No signs of scoliosis. I'm going to check for neurological deficits. Any abnormal movement in the spine muscles. I'm going to listen to your lungs and then your spine. Go ahead and take a deep breath in and exhale. And again, breathe in and exhale. Breathe in, breathe out. And again, breathe in, breathe out. One more time, breathe in, breathe out. And again, breathe in, breathe out. I'm going to listen to your spine now. I'm going to try to see if there are any loud sounds coming from fine movement of the vertebrae. Go ahead and tell me if you feel this 2 or 1 pressure point.
1, 1, 1, 1, 1, 1, 1, 1, 1, 2, 2, 2, 2.
Do you feel this on the left or right?
Left, right, right, left, right, left, middle, middle, middle.
Okay, very good. Go ahead and tell me if you feel this cold or warm.
Warm, cold, cold, warm, warm, cold.
Does this feel warm all the way down?
Yes,
What about now?
yes,
Does this feel cold all the way to the right?
yes,
And now?
yes,
Does this feel cold all the way down?
yes,
And now?
yes.
Go ahead and tell me when you don't feel the vibration anymore.
No, 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 no.
Okay. Go ahead and tell me if you feel this sharp or dull.
Sharp, 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 sharp. Dull.
Does this feel sharp all the way down?
Yeah,
Okay. Does this feel sharp or dull?
dull, dull. Sharp, sharp, dull, sharp, sharp.
Does this feel dull all the way up?
Yeah,
And does this feel dull all the way to the left?
yeah.
Okay. So we're gonna end this here. We're just gonna do the outro. You standing up. Okay, Angelina. So I do have good news. I don't think this is neurological. I think we're having an endocrinology problem. So we're gonna have to do some hormonal check. We're gonna do a blood test of the hormone levels, and I'm going to prescribe something that helps with stress. This will lower your stress level throughout the whole body, and within a month or two you're gonna feel a huge difference. Your vision is gonna come back to normal, and also you're not gonna feel all of that tingling sensation. That's not also supposed to be there as well. So I'm gonna prescribe 3 supplements. And I'm gonna have you take them every day for the next 28 days. We're gonna see how your hormone balance comes back to normal, and we'll go from there, okay?
Sounds good. Thank you.
You're welcome. Thanks for coming in.